네, 글로벌 코리아.
This is the last session for Global Korea Convention 2021. We'll be beginning the session of Kiev on international development cooperation in the era of pandemic and climate change. Thank you for joining us. I am the moderator, Chung Hwan-yu of Kiev. Welcome. Before we start with the presentation and discussion, I would like to invite our speakers for opening remark and congratulatory remark, as well as a group photo session. I would like to invite Hae-gu Jung, Chairperson of National Research Council. Please welcome him with a big hand.
Good afternoon, ladies and gentlemen. My name is Hae-gu Jung. I'm chairperson of the NRC. I would like to thank Mr. Young-soo Kim, Deputy Minister for International Development Cooperation at the Office for Government Policy Coordination, and also Mr. Hung-jong Kim, President of Kiev, for coming in spite their busy schedules. I also want to thank today's chair, Professor Bo-kyung Park from Kyunghee University. This is the last conference of 2021 Global Korea Convention, and during this session we will hear from KOICA and EDCF and KOFIH regarding how they overcame COVID-19. These agencies are, of course, the most representative ODA agencies in Korea. And, of course, we will be discussing policy direction of international development cooperation with the Ministry of Foreign Affairs, Ministry of Economy and Finance, and Office for Government Policy Coordination. So there are 40-plus agencies that are related to ODA in Korea, and there are over 150 agencies that actually implement and execute the ODA projects at the partnering countries. And as for ODA, of course, we have to go to these partnering countries to carry out the projects. However, there was a big impact because of the pandemic. We did not want the spread of the infectious disease, and we had to place restrictions on people's movements and quarantine. We had to take quarantine measures. And so it was not easy for us to carry out these numerous ODA projects. And the COVID-19 epidemic and pandemic is an unprecedented situation, and it provides us with a new challenge. We need to think about how we can carry out ODA projects in spite of these difficulties. So in the future, we will be faced with new types of crises, be it pandemics or climate change. And we need to think about how to carry out ODAs under new crisis situations. I think that discussion is very important. So at this session, we will try to convert the pandemic situation into a new turning point. And I hope that we will have fruitful discussions on how we can prepare for global challenges in this age of unpredictability, including pandemics and climate change. Thank you.
Thank you very much. Next, we would like to invite the host of this session from the Office of Government Policy Coordination. I would like to, from the Korea Institute of International Economic Policy, I would like to invite Mr. Hung-jong Kim onto the stage.
Good afternoon. We are holding the 2021 Global Korea Convention, and I would like to welcome all of you to this session, which was organized by KIEP. And I would like to thank Mr. Hae-gu Jung, Chairperson of the NRC, and also I want to thank Deputy Minister Young-soo Kim from the Office for Government Policy Coordination and our chair from Kyunghee University, Professor Bo-kyung Park. And I thank today's presenters. So from KOICA, we have Vice President Jung-hee Lim, and also from EDCF, we have Mr. Jong-gyu Park. and also Director General Bo Kyun-nam. So thank you. So we're thinking about the future direction of ODA in the Corona era. And we have representative ODA agencies, including KOICA and also KOFIH and EDCF. And of course, we're working with the Ministry of Foreign Affairs and Ministry of Economy and Finance and the Office for Government Policy Coordination. And we have representatives from these different ministries participating as discussants today. So thank you for your contribution. This session is not long. It will be for 2 hours, but I hope that it will be a very fruitful and meaningful session. As you know, we are faced with a pandemic, and we need to think about the major contents of the ODA and the future project direction. And we need to make changes because we have to respond to the needs and demands of the recipient countries, and we need to provide the most pertinent and meaningful ODA projects to these partnering countries, and we have to meet the challenges of the time. So we are experiencing this pandemic, and we are discussing the future direction of ODA, and I think that is very, very meaningful. So we will be holding this session for 2 hours, and we will be listening to presentations and the comments of the discussants. And through this session, I hope that we can share our experiences, and I hope that we will take an opportunity to think about the numerous challenges that we face. Thank you.
네, 원장님 감사합니다.
Thank you very much for your opening remark. And last but not least, we would like to invite Mr. Young-soo Kim, Deputy Minister for International Development Cooperation from Office of Government Policy Coordination. Please come up to the stage.
안녕하십니까?
Good afternoon. This is Young-soo Kim, Deputy Minister for International Development Cooperation from OPM. I would like to thank Chairperson of NRC, Hee-gu Jung, as well as the President of KIEP, Hung-jong Kim, and I would also like to thank our panel discussion chair, Professor Bo-kyung Park, and I would like to greet everyone to this session. Thank you for joining us. Following last year, we are holding the Global Korea Convention for the second year. In this convention, we are sharing the experience and achievement of working with one another and using this as a platform to enhance partnership. And it is all the more meaningful that we're holding this convention during the ODA Development and Cooperation Week that discusses the integrated plan across the government for ODA. And this conference has a very important topic, which is one of the largest challenges facing the world today, which is pandemic and climate crisis. Although COVID-19 is influencing the whole world, the magnitude of pain and damage is different across the countries. And in the process of recovery, we believe the gap between the advanced nations and developing nations is expected to be bigger. Korea has the experience as both a recipient country as well as a donor nation, and we can play a key role in adjusting and coordinating the activities between the advanced nation and developing countries. And the international community is asking us of a more strengthened role on Korea, and we need to go beyond participating in the international community's effort, but to lead in realizing global value. The COVID-19 and climate crisis will become an important testbed for all of us. We need to create a success cases where the developing countries and advanced countries can all be on board to pave way for taking our ODA to the next level. In order to do that, we need to enhance the effectiveness and efficiency of our ODA and have a concerted effort and capability across all the stakeholders, including NGOs and companies. And we need to newly define the outlook for the KODA. Since the Act on Framework for International Development and Cooperation was developed, we have set up a dedicated ODA division within Office of government policy coordination to build a foundation for legal and institutional implementation. The government will closely coordinate and communicate with the private sector to drastically improve the ODA from linking different businesses and developing strategies and reviewing and doing consequent management as well. We hope that discussion today will help us overcome the global crisis and to develop our ODA further. We will actively reflect this on the government policy. I would like to thank everyone for making this event possible. I wish you all the best. Thank you.
네, 본부장님 축하합니다.
Yes, thank you very much for those congratulatory remarks. There will be a photo session before I hand over the podium to the chairperson. So we will not have a photo session following the seminar, so I would like to invite the representatives from the host organization and also the presenters and discussants.
네, 지금 세팅해 주시면 됩니다. 네, 이상으로
So that concludes the opening ceremony part of today's session. And I would now like to hand over the microphone to Professor Bok-young Park, who will be moderating the presentations and the discussants. I would like to ask the presenters to please come up to the stage and take your seats.
네, 박종규 본부장님, 남복현 본부장님, 임정희 이사님 세 분.
Yes, I would like to invite the three presenters. So Vice President Jung Hee Lim and also Mr. Jong-kyu Park and Mr. Bok Hyun-nam.
네, 그럼 교수님 진행하시면 될 것 같습니다.
Professor, please go ahead. Good afternoon. My name is Bok-young Park. As was introduced, I'm a professor at Kyunghee University. First of all, I would like to thank Chairperson Hae-gu Chung of the NRC for hosting the 2021 Global Korea Convention. And this is the very last session. And so I would like to thank President Hung Jong-kim for his contributions and hard efforts. And I also want to thank Deputy Minister Young-soo Kim from the OPC for coming today. So last year we experienced the pandemic, and The pandemic changed everything in the world. However, it had especially a bigger impact in terms of development cooperation and international cooperation. And to overcome the pandemic, of course, there were many efforts in healthcare, and we had a great demand for emergency relief. However, because of the risk of infection, it was very difficult to carry out the specific projects. And the entire world was faced with the health crisis. However, there was a great difference between the advanced nations and the developing nations in terms of their ability to respond to such a health-related crisis. And we could see that there was a lot of fragmentation, and we saw a lot of differences and disparity among the countries. Also, COVID-19 will have a big impact in the coming future. So there will be a big shift and many changes in what we experience even after this is over. And I believe there will be the acceleration of the digital transformation, and there will be heightened conflict in the international society. That is very likely. So after COVID-19, probably we will be faced with new global tasks and new global environment. So I believe that we are faced with new challenges and tasks. And so during this session, we will be thinking about what kind of contribution we made during the pandemic, and then think about the way forward and think about the future direction as we think about what is to come after the pandemic. And there will be three presentations, and then we will have a general discussion. So let me first introduce the three presenters. First of all, from KOICA, we have Vice President Chung-hee Lim. So she will talk to us about grants. And I will give her 20 minutes.
Good afternoon. My name is Chung-hee Im of KOICA. I will be talking about the KOICA's case on the international cooperation in the areas of infectious disease and climate crisis. In the international community, the climate crisis and COVID-19 has become a big issue here. The COVID-19 has spread incredibly fast, and the impact on developing country is enormous, and the vulnerable segment in the developing country will be most affected. And vaccine support has been carried out with UN leading the effort, but there are some countries who has not been able to see vaccine, and the vaccination rate is low, and the poverty is aggravating, and the number of deaths is rising, and we need more than ever the close coordination and cooperation of the international committee. KOICA is working toward and contributing to international crisis, and we want to share how we are also working with various international organizations. This is my agenda. I'm going to talk about how we have responded to COVID-19 in KOICA and the projects that we're doing in responding to infectious disease as well as climate change. First, on the KOICA's response, we have put the Korean people's safety first. We have worked toward safe return and safety of the dispatched Koreans across the world. We have established a steering committee to review COVID-19 situation, and we have opened up 24-hour contingency operation system, and we are working in contingency with UN and international organizations, and we were able to have safe return of 1,303 volunteers and workers, as well as 292 Korean people. And we needed to safely protect 600 people who are still remaining in overseas countries. We have enacted contingency operation to come up with safety measures and scenarios, and through flexible work environment, environment, we have carried out comprehensive safety measures. In Korea, in order to participate in overcoming COVID-19, we have provided our facility for self-quarantine and for care centers for mild symptom patients. One thing I want to remind you is that we have 2,000 patients coming in from overseas, and we had about 5,300 people using our facilities, but we did not have a second round of infection. This was possible because of the robust safety measures and safety compliance that we were able to carry out within KOICA's facility. Next is the effort that we were making around our projects. We have set up a task force team for contingent strategy management, and we have set up a new organization to respond to climate crisis and infectious disease crisis. We also have shifted to non-face-to-face business management. 64% of the on-the-ground, on-site employees returned home, and we had to face shutdown in recipient countries. And some of the projects were very difficult to pursue, but due to flexible management of our project, we were able to maintain employment as well as continue on with our progress. We were able to complete 97% of our project, and we were awarded a ministerial award as a result of this good achievement. We also identified non-face-to-face ITC-related project, and this was provided to different regions where the schools were shut down. And we developed and produced non-face-to-face education content, and through online education, we were able to support students to have online education and continue their education. One example would be in Tanzania, we were able to provide online content to 250,000 students in Zanzibar's region, and in Nigeria we were able to develop content and rolled it out to all of Nigeria through pilot schools. And in Rwanda we were able to train 6,600 teachers through online training sessions. Next is on the response strategy for infectious disease. We, as part of the third International Cooperation Basic Plan, and as part of the ODA implementation plan to respond to COVID-19, and we also have developed a Building Trust project that was developed, were reflected in developing KOICA ABC program. ABC program is to enhance resilience, and from 2000 to 2004, we are providing comprehensive resilience program to different countries. This is to enhance how we respond to infectious disease, as well as we are supporting vulnerable countries in healthcare. We are providing emergency response from 2000 to 2001, and 2002 to 2004 will be resilience phase. During the first phase, we provided masks and different disease prevention devices, but in the second phase, we're going to develop new projects to respond better to infectious disease. The characteristics of ABC program is that we changed the existing program where we were unable to dispatch the officers, and we were able to secure the right level of budget to implement on time. The advantage of ABC program is that this ABC program by KOICA is focused on recipient countries. And from 160 countries, we were able to identify different vulnerable countries and support them in a multidimensional manner. The total amount of support was $173 billion, and total recipients were 41 million people. This was given out to 116 countries, and we were able to carry out 743 project cases. In 25 countries in Middle Eastern countries or CIS countries, 50 million were influenced and had received benefit, and in Africa, 41 countries, in Asia, 27 countries. I would like to briefly talk about the programs involved in ABC. A is on the countries with vulnerable health care environment. We supported vaccine development and treatment development, and as a contingent support, we were able to provide diagnosis kit as well as disease prevention kit. And in order to support resilience and sustainability, we supported employment and livelihood support activities. Also, in the B phase, we recognize the need to support infectious disease control. We were able to have 19 facilities to support COVID-19 response. Thus, we were able to quickly respond to infectious disease. At KOICA, we nurtured epidemiologists during the past disease cases, but these experts were dispatched in the current COVID situation, and we carried out various campaign and education and training sessions for residents living in the community. And last but not least, we have worked toward enhancing comprehensive cooperation. We're working to share the cases and successes, and we have provided online training, and we have built hubs to communicate with different partnering countries. We're working with civic society to directly produce masks and to distribute masks. And we have also supported people in need with the devices and equipment for preventing disease. One thing that stands out is that we distributed some of the medical carriers and equipment that was developed using proprietary Korean technologies. And 43 institutions were participating, and we were able to create export revenue impact of 50 billion won, and we take pride in being able to support some of the Korean companies. These are some of the ABC program cases. For Uzbekistan, the air flight was cut off, but the president sent his own presidential airplane to have safe return of our people. We have reviewed the current status of COVID-19 in Uzbekistan and provided software assets like the human resources and information. Through comprehensive consulting, we have contributed in Uzbekistan's response to COVID-19. Uzbekistan, as a result, is known to be one of the leading cases where they successfully controlled the spread of disease. And Korea is happy to be part of that process. In Ghana, we have pursued a global healthcare security program. And at the time, we were able to nurture epidemiologists for this existing program. And with outbreak of COVID, these experts were able to survey and inspect over 20,000 people, and we have further plans to dispatch more epidemiologists to Ghana. Next is a Nepal case. Nepal focused on providing healthcare and health care experts. This Mechikot is in an isolated area away from the capital city. It is the only government operated hospitals, but they were not ready at all to respond to COVID-19. But through working with KOICA's Nepal office and through working with KAN, the Korean Student Network, we were able to support the Nepal healthcare employees, and this hospital was designated as a COVID-19 response hospital. Next is on the climate change response program at KOICA. In Korea, we have Korea New Deal comprehensive plan, and we have 2050 carbon neutrality strategy, and we have a cross-government Green New Deal ODA strategy. we are talking about increasing the ratio for Green New Deal ODA. We want to expand the ODA level to OECD DAC level by 2025. KOICA is reflecting these plans on KOICA's 2025 climate action plan. This will serve as a foundation for our future programs. Our vision is to curb the rising temperature by 1.5 degrees Celsius to protect Earth from climate change. And our mission is to achieve 2050 carbon neutrality and to support climate resilient development. We have created different strategic goal and program. First, we want to support 2050 carbon neutrality. The key program is to support transition of carbon business. Second goal is green recovery and increasing and supporting climate adaptation. This is to enhance urban ecosystem and infrastructure resilience support. And third, we want to expand green climate partnership. Starting 2016 to 2019, we have been participating in a climate action plan, and we have contributed $54 million. This is 9%, and OECD average is 11%. So KOICA need to further increase its contribution dollars to climate change. We have about 30% of projects in the climate mitigation. This is usually in agriculture and water resources. And agriculture and water resources take up about 70%. And for goal number 1, we want to identify more of the programs in goal number 1 to balance the overall spending. Next, I would like to talk about Green Climate Fund. KOICA has obtained GCF accreditation, and we were able. And for the ESS risk or B below category, we can voluntarily decide on which program to participate for small size ESS projects. And this gives us opportunity to actually develop and identify climate change response businesses. We've had very robust operation system and with good talent. And when you look at our accounting and compliance as well as the ethics code, you can see that our level of operation has been recognized as excellent to achieve the approval from GCF. This is another case of climate change response. In Fiji, we are combining farming with photovoltaic. The total financing amount is $16 million, and contribution by KOICA is 8 million, GCF 5 million, private sector 2 million, and Fiji government is contributing $1 million. The location is Ovalau Island in Fiji, and currently the island relies 100% on fossil fuel. And by 2040, we were able to shift its energy to clean energy by 50%. We are also looking into developing new crops that could respond to climate change. But after 2025, we will be able to reduce 9 tons of carbon, and we'll be able to win projects. And currently, there are increased deaths in the global society due to COVID-19. Many experts say that the poverty will aggravate in developing countries. We have made much progress through MDG and SDG, but many predict that the current status will return us back to the past by 15 years. KOICA is working with domestic experts and the relevant institutions to come up with democratic response, and we are working toward in making our ODA project more efficient and more economic and more impactful in the global community. We ask for your support and thank you for listening.
네, 임 이사님 감사드립니다.
Yes, thank you very much.
Well, the increasing demand after COVID-19 is definitely in the climate change as well as healthcare area. In the area of healthcare, KOICA is pursuing ABC program, and there is also midterm climate change response strategy for climate response. So there are 3 pillars that is being pursued for your program. Thank you for your presentation.
The next presentation will be made by Mr. Jong-Kyu Park, who is head of the EDCF operation group at Exim Bank, and he will talk to us on the topic of credit assistance. Good afternoon. I am from the EDCF operation group. My name is Jong-Kyu Park, and I'm from Exim Bank. And I would like to talk about the response to the pandemic, so EDCF's pandemic response, and the strategy for support following COVID. So, table of comments, I would like to talk about some background information, our response to the pandemic, and then talk about support strategies in the future. So according to the WHO, well, we believe that the poverty population will increase in the future. So these are people who live on less than $1.9 a year. And in the beginning, we thought that this portion, or the number of people living in poverty, would decrease. However, things have changed because of the pandemic. And you can see that major developing nations, including India, have recorded negative growth last year. So there has been a negative impact of the pandemic. So accordingly, World Bank and ADB and major donor institutes are engaged in active activity in these numerous developing nations. And the World Bank, well, their plan was $160 billion related to corona support. Actual execution as of June of this year was $157.1 billion, and they came up with what is called a climate change action plan for 2021 to 2025. And as for ADB, their plan was a $29 billion package. That was their announcement. As of October, they have executed $21.6 billion. And in 2019, Strategy 2030 was announced. And in the post-COVID era, ADB said that they will continue to support economic recovery and also to supply vaccines. And they had a $10.4 billion program. And we also have JICA, and their plan was 700 billion yen in emergency loans. And as of October of this year, they approved 410 billion yen. And as for the results, the execution, these were not official announcements by the agencies. I just went to their websites and tried to get this information. So there could be some differences when the actual announcement is made later on. But the point I wanted to make is that all these different institutions are trying to do their best in order to provide support to the areas hit hard by COVID. Next, I would like to talk about EDCF's response to the pandemic. So I want to talk about what we did last year and what we did this year. So last year, we had a lot of support provided for the health area. And EDCF Actually, we work on bridges and airports and also hospitals and water systems. So we support infrastructure. However, there was a lot of shutdown of numerous governments, and there was limitations of movement of people, and there were difficulties in global logistics, and it was very difficult to actually deliver the materials. So we ran into problems as we tried to go ahead with our projects. Also, with the EDCF, we have governments participating in bids, or the government announces a bid, and the companies participate in this bid and try to win contracts. As for some projects, of course, we have embassies. So the Korean embassy in Kenya, for example, so they would carry out the bidding process instead of the local government. So we try to find ways to deal with the situation. However, in spite of these efforts, of course, there were delays to our projects. Also, from the developing countries side, they needed medical suits and also diagnostic kits, and there was a lot of requests for such material. And so we had emergency response program loans in the healthcare area, and it was for 7 countries amounting to $360 million. And also there were loans for emergency medical material. It was $60 million for Ethiopia and Ghana, and also credit line for CABEI. And also we had a repayment delay program that affected 26 countries. And so for project loans, for example, well, this is for 2020. So we establish or select a health-related project. So emergency plan for current quarantine measures for infectious diseases, for example. So a policy is established, and of course, we need funds to carry this project out, and we would lend credit so that the funds would be there. And that's the second part that you see on this slide, and that was $60 million that went to countries like Ethiopia and Ghana. And when we provide loans for these materials, we actually have a list of the materials that are eligible for this loan. And if we proceed that way, it takes a year or two to actually lead to purchase. But last year, we tried to streamline the process so everything could happen very fast. So we started discussions with Ethiopia in May, and we were able to complete supply in the first half of last year. So we moved very fast. As for Latin America and Central America, there were added difficulties over there. And so we worked with GABE, and we provided a credit line of $50 million, and GABE carried out re-lending of the funds. And of course, we had existing projects. We had some reserve funds for health projects. And we were able to provide this reserve fund in order to purchase additional medical items. And so medical suits and so forth, these could be purchased until April last year in several countries. And of course, we had liquidity issues, and Paris Club, G20 nations, and IMF, and so forth, worked together and had discussions to actually place a delay on the repayment of the loans. And so we announced a delay on 3 occasions. So there was first delay, second delay, and third delay, and they will be able to pay back the principal and interest in different installments over the time of 4 to 6 years. And the amount involved here would be 59.8 billion won. This is for this year, and I believe that the situation is different from last year. So rather than directly supporting the health-related sector, what we're doing is focusing more on strategic area infrastructure. And so the focus is on sustainability and also economic recovery and resilience. So these are the keywords this year. So focusing around these keywords, the developing nations will come up with strategies. And of course, there was a halt to the infrastructure projects last year, and that has hit hard the developing nations. And of course, this year these countries are trying to resume the halted projects. And we approved 2.2 billion new funds for these new projects. Last year, we were only able to approve half of that amount. But this year, we believe that we are going to be able to increase this fund size once again. And here, this is the Sustainable and Resilient Growth Program loan in Colombia. And IDB and AFD of France participated in this program. And this program is to strengthen the financial procurement and also the sustainable utilization of forestry resources. So 6 institutes got together, including EDCF, and we provided total funds of $1.2 billion. So Colombia might want to establish a tracking system for high carbon industries, and they may come up with a policy to expand electric vehicles. And we wanted to support these initiatives. And once these policies or projects are decided, then these development banks would provide the financing. And so in the midterm and long term, Korean firms will probably be able to help Colombia in carrying out these projects. Also, we supported a project to circulate the resources in Colombia, and it has to do with the solid waste management system in Colombia, and there were related projects in Colombia. And so EDCF played a big role there. And also we have demo projects for EVs and public transportation, and we wanted to do a feasibility study regarding this, and we're working on this with the Colombian government. And so we want to carry out a demonstration project and look at the feasibility to see if this can actually be realized in this country. Next, I would like to talk about our strategy for the coming few years, so year 2021 to 2023. So we have some areas where we're seeing growing demand, and we want to focus on these areas. So we have these 4 strategies. And of course, this is in line with the international trend. So I met with Mr. Seo of the ADB, and he talked about 3 trends. So digitalization, pandemic, and also climate change. So he is in charge of actual operation, not just policy. And he said that ADB is focusing on these 3 areas, and I think we are in line with that. So we have green and digital. For these sectors, well, they are actually cross-cutting sectors. And so in the green sectors, we want to take advantage of the digital elements in the green area. And so for green, it will be 600 million in 2025, up from 200 million in 2020. So for digital, it will be 800 million instead of the 300 million in 2020. So these are the plans that we have. And we also have plans for the health-related EDCF and also for investment. So here we have what is called a green EDCF, and we have different EDCF projects, and we came up with a self-developed index in order to calculate how green this project is. And we will be looking at 4 different indices. So how much climate change mitigation there is, how much climate change adaptation there is, and circular economy, and also social inclusiveness. And in the beginning of year 2000, the total figure or the total score was 1.5, but we established plans so that this could be increased to about 2.25. And so we're working on safeguards, and we want to take into consideration climate change whenever EDCF carries out different projects. So when we're trying to discover new projects, we look at any threats to climate change, and then we think about what kind of mitigation measures there could be and how we can monitor that. And of course, that will be reflected to the KPIs. And by doing that, we can make a prediction of the outcome. For example, let's say we want to build roads and there's a project on that. And because of climate change, there's more rainfall. Then in that case, we may want to have a higher level of the road, or we want to make the drainage systems bigger. Or the same thing for sewage systems. We have pipe diameters that we conventionally use. But if the rainfall amount increases, we may want to use pipes with bigger diameters. And so we can plan this in the designing stage. And the coastal areas, we might want to build walls or pikes or build the infrastructures at a higher sea level. So this is something that we want to look at and consider beforehand. And then we have the advancements of the safeguards. And so we will be looking at the impact in the environment and society as part of the feasibility study. But we want to do this from the very beginning and do basic information gathering and basic assessment from the very beginning, and then come up with the safeguards that will really work. Next is digital EDCF. So here we're going for e-government and also smart city. Now, as for smart city, this is a very comprehensive concept. So Indonesia is trying to move its capital. So we are trying to make all the infrastructure within a city smart. And of course, transport will play a big role here as well. And we want to employ ITS for transport, and we want to employ hospital intelligence systems and smart systems to control and manage our water systems. And when we give loans to these developing nations, well, they lack the basic infrastructure. They don't have a water system. And so in some cases, they just want the pipes and a water treatment system. However, if we can apply an automatic water purifying system, that will bump up the cost by 10%, and it will make the system much more efficient. But the other party is very reluctant because of that 10% additional cost. However, we have experience in many of these areas, and so we should encourage these governments to adopt a smart management system, because in the longer run, that will be the cheaper choice. And also, there's a lot of demand for digital in the new southern policy nations. And in countries like this, they don't really have e-government, and so everything is document-based. And we can work on the tax system, education, and so forth. And many projects are going on here. There is demand, and I think we should take full advantage of the experience that we have. Next, health EDCF. Now, as for health-related projects, well, actually, the efficient maintenance and operation of these facilities is even more important than building the infrastructure itself. And the situation differs greatly from country to country. And that is why we need to cooperate with the grant providing agency from the very beginning and provide the infrastructure plus the maintenance that will come later on as a package. And based on the experience that we have regarding the pandemic from last year, well, we have some response systems. And in the past, we basically worked on hospital material and also hospitals regular general hospitals and children's hospitals. However, the need is becoming diversified, and they require a CDC, for example. And so we want to diversify the projects that we carry out. Next is supporting projects based on investment development. And so in this case, we want to recruit private entities. And so when we carry out ODA projects, well, for the private sector to participate, there's a lot of risk involved, and so the ODA entity has to play a vital role, and we have to find a way to share the burden in a fair way. And there are numerous ways of participating in the investment development, and the private party can be part of the investment fund, and the government or the state of the receiving nation can participate in that fund or consortium. And of course, there is a second model here. We support the surrounding infrastructure, and LH is working on that. It's not going smoothly right now because of the pandemic, but anyhow, these are the other type of projects that we work on. And the third type is to have partial support. So for example, we want to collect water from a water source. And we will have the recipient country government working on that. As for the water purifying facility, we could have another entity that invests in that. And so in order to be efficient with all these different projects, I believe that there has to be a close link between the agencies that are in charge of the grants and the agencies in charge of the credit assistance. And of course, with KOICA, we have cooperation for all these stages. And we have to consider the expertise of the different agencies and the roles that they can play at these different stages. And I have 3 cases in my subsequent slides, but I would like to wrap up with by showing you just one example, the case of Indonesia. So this is the Jakarta area, and we want to provide drinking water. And we have the Karian Dam on the left, and EDCF provided support for this dam. And the dam is currently being built as we speak. And then we have the EDPF, and that is the support for providing water pipes from the dam to the treatment facility. And currently discussions are ongoing for this part of the project. And we have the K-Water Consortium. So there was a bid announced by the Indonesian government, and K-Water Consortium won that bid. And dialogue is currently going on regarding this project, and you can see that Korea will be heavily involved in building the dam and the pipes and so forth. And so this is the first case of Water Industry Team Korea, which is a PPP, making inroads to the overseas market for the first time. And so Korea is involved and supporting this very big infrastructure project in a developing nation. And I believe that we will see great results in the end. So I believe that is a great case, so that is why I wanted to share that with you. And then as for the other cases, please refer to my slides. And so I hope that we will be able to fully utilize the strategy that I outlined, and we at EDCF will do our best to do that as well. Yes, thank you very much. So at EDCF, you talked about the strategies that you have for post-COVID era, and we want to build up the capacity of the developing nations. And you also talked about how you reflect in each of the cycle steps the impact on climate change, and you talked about the green index and also about the advancements of the safeguards. So that was great. And also you talked about the different situation in the different countries and talked about customization. So that was great.
Next, we have with us from Korea Foundation for International Healthcare. We have with us Bo Kyun-nam, Director General of KFIH. Please welcome him with a big hand. Nice to meet you. From KOFI, I am the Director General for Global Cooperation, Bo Kyun-nam. Thank you for giving me the opportunity to present. I would like to talk about the healthcare ODA during the post-COVID-19. I would like to talk about the healthcare ODA in COVID-19, and this is my agenda. We would like to go over the healthcare issue and go over the current status of healthcare ODA and end with the future challenges and directions for healthcare ODA. First is on the COVID-19 situation and healthcare issue. This is the current COVID-19 situation. As you can see on a weekly basis and also on a globally, this is the overall trend. And what you see on the bottom is the trend here in Korea. Globally, what you can see is that you see the confirmed cases on top and the number of deaths on below. As you can see on the graph, the trend of confirmed cases and deaths is coinciding with each other. This number was captured from WHO webpage on October 28th in 2021. On the next day, according to another private institution, the number exceeded the death exceeded 5 million. In Korea, we've had a hike, but since the start of the vaccination, the number has been stabilized for confirmed cases. But in the fourth infection phases, we saw increase in cases, and as you can see, accordingly, the number of deaths is also climbing. This is the number of confirmed cases across the country. The US is number 1, and India is number 2, and Brazil is number 3, followed by the UK, and Russia is number 5 in terms of number of fifth case. Korea is 74th, and China is 113th rank, and North Korea's data is not available. This is the current status of COVID-19. The blue line is number of confirmed cases. By age group, 50s, 20s, and 40s are the order of the most frequent number of confirmed cases. And the death is highest in the elderly population, and mortality rate is also high in the elderly cases. 70-plus elderlies have increased spike in mortality rate. When you look at the disease prevention measures, we have day-to-day prevention effort as well as a medical effort. So day-to-day prevention measures would be to wear masks, doing social distancing, and using
세계적 찬사를 얻은
alcohol as well as washing hands. And medically, there's diagnosis and epidemiological inspections as well as
대비인 생활 방역의 효과에 대해
quarantine and treatments as well as vaccination. As you can see, there is impact of non-pharmaceutical measures for COVID-19. There has been shutdown of schools, international travel controls, school closures and public transport and workplace closure, as well as public event cancellation, and also restriction on gathering and stay-at-home requirement, as well as on internal movement. As you can see, that school closure and workplace closure had a big impact in reducing COVID-19. And in the U.S., the COVID-19 has actually spread faster than the originating country, China. But rather than coming up with joint measures to curb the disease, there has been a lot of blaming. There has been a leadership clash between the U.S. and China, and due to this conflict, the leadership of WHO is unstable. If we were to have very strong WHO leadership, we were able to respond early on and control pandemic better than where we are today. And there is also imbalance in distribution of vaccines. High-income countries have high ratio of vaccine doses, but low-income countries have lower vaccine doses purchased compared to total population.
WHO 코비드 팬데믹 기간 동안에 25개
During COVID-19,
설문조사를 실시했는데
there has been a survey on 25 essential health services. It includes family planning and contraception, antenatal care, facility-based birth, nutrition management and control, and malaria, TB cases, and cancer diagnosis, dental services, and urgent blood transfusion, and 24-hour emergency services. These 25 services are the essential health service that will be required during COVID-19 pandemic. The survey was carried out in 25 countries, 152 countries, and we looked into different countries by income bracket that experienced service suspension. 23% was the global average, and low-income countries, in low-income countries, 45% experienced health service disruption, but only 4% in high-income countries. We surveyed the country priorities and technical assistance needs, and there has been about 233 technical assistance need, and 60 was the most required services, which is maintaining essential health, which was followed by a need for essential supplies as well as health workforce strengthening. When you look at the healthcare issue due to COVID-19, it could be divided into leadership, well-being, and health security. First, on leadership, the early WHO response was not optimal, and the conflict between the U.S. and China didn't help with the overall disease control, and there has been imbalance in vaccine distribution, and there's a low accessibility to healthcare service, and there was lack of consideration for vulnerable people, and there has been lack of cooperation and information sharing for fast support, followed by lack of global response and regional response when it comes to health securities. Next is on healthcare ODA. When you look at the overall global public health scope, it could be enhancing health and environmental health, health industry, statistics and epidemiology, as well as healthcare policy and international healthcare. This is in line. I'm going to match this with the ODA situation. This is the value chain for healthcare ODA. The mission is to have health for all and to provide healthcare services in an effective way for everyone to access. In order to do that, in RMNCH, there is a detailed goal of achieving health for maternity and infant, child as well. There is also a problem of lack of monitoring and governance and lack of healthcare patients. And we will be able to achieve universal health coverage by overcoming these challenges faced by healthcare. The objective ODA and the paradigm of ODA has changed. Jeffrey Sachs asserted that there is a development effectiveness. In order to improve healthcare situation, the aid needs to be increased. And Orderly also criticized the aid, and they focused on the effective ODA and emphasizes the importance of effective ODA, and we need to shift from aid effectiveness to the development effectiveness. Through 4 rounds of high-level official conferences, we are making this paradigm change a reality. And we have also looked into healthcare ODA from a recipient standpoint. In case of Ethiopia, there is a heightened competition between donors. We have small budget in terms of ODA, and relatively speaking, the officials from a recipient country has less interest, and that's one of the issues we have to pay attention to. This is a case of Laos. In Laos, out of 33 donor countries, China has the largest donor, and we're about 6th donor country following China, World Bank, ADB, Taiwan, and Australia. Kofi office is working with Laos government, and we're achieving much result by jointly working with the local government. Next is on the challenges and direction for healthcare ODA. Kofi has a total of 9 overseas offices. During COVID-19, we are providing PCR, PPE, as well as diagnostic kit and medical equipment such as ventilators and PT monitors. And EDCF has provided funding, and we were able to provide PPE to 5 countries, and Ministry of Foreign Affairs supported $5 billion, and we were able to provide PCR diagnostic kits to different partnering countries. In August this year, Romania provided vaccine, and Romania requested medical aid to us. And we were able to provide medical equipment and devices worth 12 billion won through our agency, Kofi. As you can see in these exchanges, strictly speaking, we can also cover not just ODA areas, but we're also leveraging our expertise and experience to promote international cooperation in healthcare area. These are some of the learnings from our activities in the foundation. We're doing local context and on-site projects, and we're leveraging external and internal resources effectively, and we are mindful of accountability and sustainability to manage our risk. However, we need to do a result-based. Currently we're doing a result-based management rather than fact-based management. There's a potential risk of frequently changing manpower, and there's also social and political risk for partnering countries.
그러면 향후 포스트 코로나
Then going forward,
코피 재단은 어떻게
how will COFI respond
함께
post-COVID era?
분명한 점은
What is clear is that after COVID,
수요와 공급이
the demand and supply for ODA in healthcare will be uncertain.
백과 전문으로 전문가들의 제안, 요구 예측이
There is
것으로 예상.
going to be a surge in proposal, demand, and forecast by different stakeholders and experts. Currently, we are carrying out many projects, and that has become a burden. So we need to robustly work with relevant institutions, and we want to develop COFI's internal model to work with different institutions. Currently, we're working with EDCF in terms of hospital operation and consulting. And once this project is completed, COFI provided operation consulting business. But in the future, COFI will be involved from early on in hospital operation to enhance effectiveness of ODA. COICA is providing different regional healthcare projects and will share that information to increase effectiveness. Going forward in the next few years, there will be the increase in communicable disease. So we need to build an infrastructure to work together in preventing and controlling these communicable disease. Next is the future direction in healthcare ODA. We need comprehensive understanding of the partnering countries, and during the implementation phase, we need to work and collaborate with one another, and we want to pursue evidence-based management. Next is on our future challenges. We need to enhance healthcare system, including the first tertiary healthcare system. And in Korea, we need to link and converge different areas to provide assistance where we have the competitive advantage. What is more important, we need to build a consensus across Korean people on providing ODA. And through that, we'll be able to meet the Sustainable Development Goal. Thank you for listening. Director Nam, thank you very much. COFI has provided a lot of grassroots level cooperation in COVID-19. And after COVID-19, you also talked about your strategy for responding in post-COVID-19. We have 3 panelists for discussion from Ministry of Economy and Finance, MOEF. We have Mr. Kwang Chul-ji, Director General for Development Finance Bureau. And also we have Mr. Chu Hoon Kang, of Director General for Development Policy and Planning from Office for Government Policy and Coordination. And we have, joining through video conferencing, we have Mr. Cho Yeon-moo from Ministry of Foreign Affairs and Foreign Affairs. Please welcome them with a big hand. All 3 of these panelists are coming from ODA-related teams. And during COVID, we have gathered much learning from providing ODA, and they'll be able to talk to us about our future directions. And it will be great to hear from them about the future plan. After this session, there is a closing session for Global Korea Convention, so we need to be on time, but we are running short of time. So I'm able to give about 7 minutes each for each of the panelists. With that, first, I would like to invite Mr. Young-moo Jo, Director General for Development Cooperation with MILFA.
Good afternoon. My name is Young-moo Cho. I'm Director General for Development Cooperation. So I would like to thank the 3 presenters. Your presentations were very informative. When I participate in international conferences or bilateral discussions, well, the main topic is climate change and COVID-19. And regarding these 2 issues, I would like to talk about what the Korean government has in mind, so our future plans, and talk about my opinion on future direction for development cooperation. Now, for COVID-19, this is not an issue limited to just health, but it has ramifications for the entire society. And also, we have bipolarization in the international community because of the pandemic. Also, we have developing nations that lack the ability to respond appropriately. And we are thinking about how much of the SDGs that we have achieved. And we have the increase of the people living in poverty. So the international community is very much concerned. And as Koika and Kofi has said, we have unfairness in the provision of vaccines among the nations, and there are very big gaps among the nations. Now, with COVID-19, it is a very multifaceted threat, and it has a negative impact on the socio-economic development of developing nations. And to deal with this, the government has come up with numerous plans, ODA plans, to support the developing nations. And so we want to create a world that is safe for all. And the first area is humanitarian aid. Second is cooperation in health. And third is to support in economic capability. As for the first area, well, we provided emergency relief items multilaterally and bilaterally. So we have strength in diagnostic kits, and also we were able to supply ample masks in Korea, and so we were able to provide masks to overseas nations as well. In relation to the vaccines, the president has committed 100 million in terms of the vaccine support. And also, if we have a surplus of vaccines in Korea, we can provide them to other nations. And also, the second area in health, well, we don't want the support to be short term. So we want to teach these people how to fish rather than provide the fish. And that is why we have selected some partnering nations for each of the continents, and especially for Africa, we're focusing on GDC and we're working on capacity building in the health area. And the third part has to do with supporting socio-economic capabilities, and COVID-19 is impacting society and economy in the long term. And that is why we are including epidemic-related aspects in our support package for the economy and social development. So these are the efforts that the Korean government have been making. And so we are doing development cooperation. We are providing material and products. And so the evaluation and assessment regarding what we have done was quite good, and the response was quite favorable in the international society. And many people said that we should be sharing our best practice. And we have a task force formed, and we held a seminar or bilateral talks so that we can readily share the experience that we have built up. And we have tried to share our experience and knowledge when it comes to boosting the economy under these difficult times. And of course, many different countries are announcing carbon neutrality, and we had the COP26 meeting and P4G meetings and so forth. So climate change is a very important issue. So as for responding to climate change, it is not just the advanced nations that can solve this problem. We need the hard effort of the many nations that emit high level of carbon. And of course, the Korean government is responsible as well, and we are putting in a lot of effort to deal with this issue. Now, with the P4G meeting, we have many programs in place. And we will be doubling the fund for this to $200 million. And as the presenters have said, we have the Green ODA strategy. And that's one of our initiatives. So of the ODA projects, by 2025, we want the portion of these ODAs to be green ODAs to be above the OECD average. And we will be working on reduction of greenhouse gases and so forth. And also we have GCF and GGGI and also the Asian Forestry Service, and we will be cooperating with these different entities. And Koika talked about GCF, and we believe that this agency, the Koika received the certificate of accreditation. And as for implications and as for future directions of development cooperation, well, first of all, of course, fund is always lacking, so we have to expand the budget. And also, when we carry out projects, the process has to be more flexible. And as for humanitarian aid, that is the budget from MOFA, and it is about 124 billion won. It is much more than what we had in the past. However, it is still very, very lacking. And of course, there was a lot of need and demand for support regarding COVID-19. And so we have to expand our budget for humanitarian aid. And so rather than responding as the need arises, I believe that we have to increase the budget for humanitarian aid to begin with. And likewise, we have to support innovative development. And as you know well, we have a fund to combat diseases, and we levy 1,000 won per plane ticket. However, not many plane tickets were sold because of the pandemic, so it's a very ironic situation. But we need to review and consider many other innovative projects. And also the third thing I want to talk about is mixed financing. And so we need to come up with effective ways of financing. And we have different parties, the public party and the private party. And we also need the participation of the developing nations. So we need mixed financing. And as for flexibility of the implementation plans, well, we have N-2 preliminary analysis. And so that is why it is very difficult to review everything in the very early stages. So perhaps we should utilize a fast track method. And we need to cooperate with other nations, and the cooperation with the relevant agencies in the recipient country is most important. And we need to work with civic organizations and corporations that exist in the partnering countries, and their capacities have to be enhanced. Also, our competitiveness lies with experience and knowledge, and we can provide more advice to the partnering nations. And thirdly, well, it has to do with the digital strategy or the importance of digital. And when we go overseas for business trips, of course, there's a limit on movement of people, and we have to carry out numerous business projects and government projects online, and this shows us how important digital technology is. And President Moon has talked about the digital gap in very important international forums. And so, yes, we do need digital technology. And as for digital, it's very effective. It's effective technology, but we have to think about protection of privacy and personal information. So there are some pitfalls to look out for as we employ digital technology. And perhaps there could be a digital gap, which could be an important issue. And also ICT, and also we have science-related ODA, and we need to promote this. And I believe that the industries are working hard on this. And we have competitiveness in science and ICT, and we should use that to our full advantage. And lastly, we need to come up with a very comprehensive and integrated strategy. We have health care related crises, but it has a big impact that goes outside the area of health. And this is tied to the development of the different nations. It is linked to humanitarian aid. So we need to have a more comprehensive view. And we can employ methods that are not ODA, or we can be creative and think about adding grants to the credit issuance. And also, I want to emphasize the importance of partnership, because the government cannot do all this alone. We need to expand cooperation with the private firms, and we need to consider ESG, and firms are realizing the importance of ESG. And also cooperation with the civil society. And we have civic groups and civil societies that exist in the different nations, and we have to strengthen our network with these organizations. And the Global Partnership Forum will be held from tomorrow, hosted by MOFA. And we will be talking about development agenda, and we need inclusive partnership. That's one of the 4 key strategies in order to make things more efficient. Mr. Cho, can you wrap up? Time is limited. So in conclusion, in terms of development cooperation, that will not solve all problems. However, we once again realize the importance of development cooperation, and Korea can play a very important role. And after joining the OECD for 10 years, we have come a far way. However, there are many more things that we can do in the future. So on that note, I would like to finish. Thank you.
Next is on financial cooperation. Director General Ji Kwang-chol will be speaking on the financial cooperation. You have 6 to 7 minutes. Thank you. I would like to thank Kiev as well as NRC for making this event possible. And also, I would like to thank Chair Haegu Jung for being with us until the very end of the program. I'll be very brief. What I want to mention is that I really enjoyed the 3 presentations today. When you look at how Korea responded to COVID-19, the international community is impressed on how we were able to balance both economy as well as disease prevention. I had an opportunity to talk with high-level officials and OECD, and that's what I hear. We were able to get vaccinated, and we reached 70% of vaccination in a relatively short period of time. So Korea and Koreans tend to rush things, and we have this pali culture where I think it really helped in getting the population vaccinated, and how we responded to the disease control is something that international community is impressed with. We also had some challenges in disease prevention and quarantine measures, as well as balance that with economic activity was an important thing. But in Korea, there was no complete shutdown within the countries, and I think that is something that we can leverage in ODA. We have COFI and KOICA, but when it comes to our partnering countries, what they want to learn, and I think that's something that I want to take away from Korea. Of course, there's a trade-off relationship between the two, so it's difficult to make that policy decision, but that is something that we have to think about when we actually execute cooperation and development assistance to our partnering countries. I know it is very difficult to execute. Internally, we did not have a complete shutdown, but our exchanges with overseas countries has been shut down. So using digital and IT technology was an important means to continue on that exchange. In that light, within MOF, we have carried out about 3 programs, And I would like to introduce to you these 3 cases to add to what was already mentioned by our speakers. In order for fast support through EDCF, we have adopted assistance for contingency aid. So we would approve the ODA in advance, and we would also get approval for sharing. And when there is contingency or emergency matters, then we would fast track aid provision. When it is difficult to anticipate this emergency coming, we have ceiling of $200 million, and the ceiling is 0.05% under EDCF, and we can withdraw this amount within a year. From approval to a contract and execution, the whole process is expedited. And when there is climate change and disasters that is taking place, we can use this emergency fund for effectively respond to such situations. We did demand survey, and as a result, we have identified 2 programs in Cambodia and the Philippines, and starting 2022, we will be implementing these programs. Our second case is that we're working with ADB in vaccine cooperation in the Philippines. Korea is working to build global vaccine hub, and within this year, we're working toward to distributing vaccine within the region. By working with ADB, we have developed a program to nurture vaccine experts and vaccine-related human resources. And through a trust fund, we are enhancing vaccine delivery system to developing countries together with ADB. And when it comes to vaccine and the relevant material suppliers can leverage ADB fund and private financing fund, and we have worked to leverage this fund when it comes to loan and credit and guarantee. Through this financing mechanism, we're investing into JV in Vietnam with the help from ADB. Once vaccine development is completed, our vaccine producers can participate in securing this fund. Lastly, I would like to talk about climate change related program. I would like to congratulate KOICA for getting GCF accreditation in July. It's not easy to do that. KDB was accredited to get GCF approval. We're trying to get that too. One good news is that we were the chair country, and next year we will continue on with our position as a board of director, and GCF will be a place where we can also have a leading role to contribute in international corporations. So I believe we can contribute in carrying out different climate change related activities. And under UNFCCC, we're working with UNFCCC to provide $1 billion per year, and through the next 3 years to provide total of $3 billion. And we have set up Green New Deal Trust Fund. It's a new trust fund to support green industries, including the fuel cell business. So going forward, I would like to leverage events like today's event to share the wisdom of different institutions, and we would also like to find future direction for international cooperation and development. And Office of Government Policy and Coordination is pursuing a lot of solidarity and joint effort, as well as sharing of different findings. So the cross-ministerial cooperation is becoming ever more stronger. I believe that will become the strength of Korea, and especially in MOEF, we're going to strengthen our cooperation with MDB even more so that our findings and learnings could disseminate to different countries. Thank you for that. You have talked about enhancing cooperation with the international institutions.
올해 이제
This year, we had coordination of the development cooperation at the government level, and we have the Development Policy and Planning Bureau at the Office for Government Policy Coordination. And the Director General for Development Policy and Planning, Mr. Chu Hong-kang, will make his comments. Yes, good afternoon. My name is Chu Hong-kang, as was introduced. And I am the last person to go, and I think time is very, very limited. And yes, I would like to thank the previous discussant for making his comments brief. So I would like to thank the NRC and also the KIEP for putting together this session, and I would like to thank the presenters. So I believe that there was a lot of repeat in the comments, so I would like to give a bird's eye view of the situation. So the ODA is business that we carry out overseas with the government budget. And so I pay keen attention to changes in the global environment. And I pay attention to the demand for the type of ODA coming from the global community. And regarding the pandemic and the climate change, well, these are major changes. And these challenges provide us with very serious challenges. And regarding the pandemic and climate change, well, actually I don't think they are separate. They are interlinked. And as you are well aware, the problems are very complex and comprehensive and not simple. So we have to change the mindset of the people. It has to do with the knowledge level that we have, and it is related to infrastructure in society and so forth. And all of these things have to come together in order for us to deal and solve these problems. Now, in the pandemic situation, we have to make pan-ministerial and pan-governmental efforts. And the situation is the same in developing nations, and the situation is the same for the issue of climate change as well. So we're talking about carbon neutrality. We have a committee on achieving carbon neutrality, and we're all trying to come together to solve this very important challenge, both the public sector and the private sector. So when we are faced with these new and important threats, climate change and the pandemic, well, it means that the way we do business, the way we engage in projects has to change. And we have done well in our ODA projects, but I think we have room for improvement. In the past, we have made fragmented efforts. However, in the future, we have to make more integrated, more comprehensive approach and efforts. And to make that possible, I believe that we have to be more comprehensive and also consistent in support. And also we have to work with other parties. And also we have to have the right scale in our volumes. And we need to engage in win-win or mutually beneficial ODAs. And so at the Office for Government Policy Coordination, we have greatly revised our law or the legislature on development cooperation. And the Prime Minister heads this committee, and he is emphasizing that we have a more comprehensive and integrated approach, and that is why we have this new Bureau for Development Policy and Planning that has been installed. And our approach is to have that integrated and comprehensive approach. And so we emphasize most of all strategy setting. And we set up midterm and long-term strategies for the recipient countries. And we established plans, the support plans for the post-COVID era, and we came up with ODA project strategies as well. So everyone involved has to have this comprehensive perspective. And accordingly, we have revised our ODA strategies. But it is not just a strategy. We have to evaluate and assess our projects, and we have to do a good job of that assessment to choose the right projects. And then as for the approved projects, then the ODA agencies can freely implement the projects. And then after the projects are completed, then of course we have to carry out evaluation once again so that we can build upon the successful projects. And then for the ones that did not show good results, we need to respond accordingly. So I talked about this inclusive and comprehensive approach and strategy. And in the second half of this year, we will work on strengthening communication among the relevant agencies so that we can share this perspective. And we carried out an online workshop so that the relevant agencies could meet online. And also there was a consultative session of the local autonomous governments to discuss this issue. And so we have a relationship between the central government and the local autonomous governments. But then what the government does has a very close relation. They need to have a very close relationship with what goes on in the recipient countries. So there were online meetings with the recipient countries, and we had these online meetings with 2 continents recently, and then in the coming month, next month, I believe, we will have the similar meeting with the 2 remaining continents, including Latin America. And so all related agencies, we all have to come together. So we are in a very new environment. We're faced with the threats of the pandemic, and we really need to think about how we can be more effective and efficient when we carry out the ODA projects. And that is all. Thank you. Yes, thank you very much. I listened to all the presentations and the comments made by the discussants, and this is what I'm thinking. We experienced the pandemic for the last 2 years, and we are faced with new conditions and different environment. And I think we have to think about 4 things.
Everyone says that our position or our reputation has gone up during the COVID-19 because we were able to have successful disease control, and we were able to do diagnostic kit sharing in advance, and we will also have soft power. And by combining this different technology with soft power, we believe that we were able to have a better or higher reputation around the international community. So we need to further develop this going forward. And during post-pandemic era, we may see the emergence of new demand like the digital transformation as well as need for healthcare assistance. So we have to think about how we're going to distribute resources and human resources for these kind of assistance. And during the pandemic, what we learned is that once there is an emergent need, how are we going to and how fast are we going to respond to this emergent situation is critical. KOICA talked about this, and EDCF also mentioned this, but we need something. And we made an attempt to successfully provide and meet this emergency situations. And such a situation may arise in the future. And when this situation arises, we need to provide quick assistance, and we have to institutionalize and expand non-face-to-face assistance. And lastly, as many mentioned, especially by Mr. Cho from MOFA, mentioned, we no longer should limit ODA to government ODA. We need to build a solid partnerships. There are many CSR activities by Korean companies, and many companies provided emergent healthcare assistance as well. Recently, for instance, ESG has become a very important topic. So ESG could potentially be combined with ODA, and how are we going to do that could be something that we have to think about. And we have to have a closer relationship with the international organization to increase the impact of Korean ODA in the global community. So these 4 issues will be an important issue to look into in the post-COVID area in order for us to upgrade our overseas development and cooperation assistance in the future. So I think that could be the summary that I can provide for this session. And many, I believe, would agree to the need that I have talked about. We only have 2 to 3 minutes left. So I don't think there was a question raised to our presenters. So if you have any question from the floor, I would like to accommodate questions from the floor if there is any question. Is there any question? If not, I would like to ask our presenters ask whether you have anything to add. If not, then with that, I would like to close our session. And as I have mentioned, we have new challenges ahead of us, and we need to look into the current situation and think about the way forward. I would like to thank our 3 presenters as well as our 3 discussants for your valuable participation. Also, I would like to thank Kiev for making this event possible. Thank you. We would like to end with a big applause.